Hi, this is Lisa Haupert, and I talked to you just a couple of days ago about having a belt lipectomy or lower body lift. And this is November 28th, 2012, and my procedure is scheduled for tomorrow. So today I went to my surgeon, Dr. Al Cram in Iowa City, and had my pre-op visit where the primary purpose is to answer any questions I have and then to do an initial marking all across the abdomen and back of where he wants to cut and what he calls his wish line, where he would like to be able to lift the skin up to or pull the skin down to, as it were. And I'll show you that in a little bit. But there's a couple of things I have here on my little cheat sheet of paper that I want to mention to you that if you're thinking about having this surgery or are having it, I think they're important things to discuss with your surgeon. One is pain management. It's my understanding that this can be a pretty painful post-op procedure. Um, and you just need a clear direction from your physician about what the pain management plan is. This particular surgeon and anesthesiology group actually give people who are having this surgery an epidural for the first 36 hours post-surgery to help with the pain management and to ensure that you get up the night of surgery and actually walk. And that does wonderful things for your body. It's really, really important. It cuts down your risk of blood clots. It helps you breathe more deeply and perfuse your lungs after having several hours of anesthesia. Gets the blood flowing. And so that's the main reason they chose to do this. But different surgeons do it different ways. So make sure you're clear about that. Make sure that if you're in the hospital or even if you're going home perhaps, that you have some foot pumps or some sort of compression device on your legs when you're in the bed to decrease the risk of blood clots. This is, I think, a really important thing, and that's one of the risks of any surgery, in particular a longer surgery, is the risk of blood clots. So you really want to make sure you've got that going on. And also ask them about antibiotics. They're going to give me a dose of antibiotics pre-op, and I wanted to make sure that I needed to find out whether I was going to get some post-op, whether to expect those or not. And with this particular surgeon, it's no. So just a few of the things for you to think about. So when I went in today, what he did was marked me all over, and I'm going to show you some of this. Again, it's pretty graphic. You get to see my skin and stuff. So if you don't want to watch this part, turn it off, which is just fine, or fast forward. But I'm going to go ahead and show you where he plans to cut and where he plans to reach to. In this surgery, when he does the front side, he actually has the head of the surgery bed elevated probably to about 30 degrees would be my best guess. I don't know if it's more than that or not, but probably around 30 degrees. And of course, when you do that, even if you don't have loose skin, you can feel a little loose skin. And so that enables him to actually pull the skin down a little further. He also has your knees bent during the surgery. So this particular surgeon's procedure is he does the front first. He cuts along the pubic area, and then he pulls the skin from above down to the pubic area. Then he turns you on either the left or right side, and the incision actually goes up above the butt cheeks, and he pulls the skin from below to meet that, or I should say the cut line goes up above the butt cheeks, and he pulls the skin up to meet there. And I understand different surgeons do different things. Some just lay you stomach and then back, but this man goes front, then side, then side. So let me get the camera fixed here so that you can see what's going on, and I may have to redo that again. So these lines, most of these are just markers. So this line right here that's coming down the middle is just so he knows where my middle is. They do excise the belly button, okay? So they cut a circle around here and kind of stuff it back down into the abdominal cavity or into the, above the muscle there. And later, once the skin's all pulled and sorted, he'll make a new incision for my belly button, pull it back through, and suture it in. So that's just to mark where my belly button should be. There's my belly button. And then here's the line down. So this line here is what he calls his wish line. This is where he hopes to pull the lower skin up to and Then this is, you'll see the dark line here. This is the cut line, okay, on this side, and again on this side. And I get a little dyslexic working with video. Sorry about that. And this side, and so he plans to pull this, and I'm going to bend over as if it was the actual surgery in the position I'd be in. His goal would be to get from there, from that bottom line all the way to that top line. So you see that's quite a bit of tissue that's going to be removed. These little markers here are where he plans to match up. So this one matches to the marker below, which is right here. Okay. Then he turns me on my side after that, and at this line here, this then becomes the wish line, this line back here. No, this then becomes the cut line, the line back here. And the wish line is way, let's see if we can even find it. It is way, way down here. So you can see how much, especially with my particular pear-shapedness, how much tissue he plans to excise. It's all of that. And again, the position I'll be in is something like that, and through all his years of experience, it's going to be like that much of a pull-up. So that just gives you an idea of what's going on, what the pre-op day is about. And just, you know, for general surgery, usually you have nothing to eat or drink after midnight. Just being a nurse, I recommend that you don't eat a lot at your evening meal. With anesthesia, bowel activity and everything slows down. So eat lightly. And also, if you're taking any regular medications, the doctor will specifically give you instructions on what medications to take or not take the morning of surgery. I'm not on any regular medications, so that wasn't a question I had to ask. But if you are, make sure you ask and follow those instructions as well. So thank you so much, and I will see you on the other side of this surgery. I don't know when I'll get back to you, if the day after or even maybe 3 days after. But I'll get back to you then, and we'll share that part of the journey as well. I hope this helped. Bye-bye.